This is groundbreaking. What the dentistry board is saying is that we recognize this problem.
Lawmakers and health officials scrambling to take action in the wake of a health scare involving a Tulsa oral surgeon. And that's where we begin here at 10.
The days of only inspecting dentist offices when complaints are filed are about to be a thing of the past. Tonight, the 2 News investigators confirmed the new information about changes coming to doctors and dentist offices near you.
Routinely, I'm out in the field doing inspection work.
Larry Little's an inspector with the Tulsa City County Health Department. He spends his days checking out restaurants, swimming pools, barber shops, and other establishments where health and safety issues impact the public. Larry believes that businesses will do a better job of being clean and safe if they know an inspector will soon be knocking on their door.
I don't know that there's a great tendency to cut corners, but I think that there is that segment that does or would.
Statewide, more than 140,000 individuals and businesses are inspected on a regular basis. Doctors and dentist offices do not get a complete inspection unless a complaint is filed. That may have led to the health crisis involving Tulsa area oral surgeon Dr. Scott Harrington. A 17-count complaint against Dr. Harrington calls the surgeon a menace to the public health. It alleges investigators found multiple tools that appear to be rusted, used the same vial of medication on multiple patients, failed to keep records of narcotics, and that untrained dental assistants used medications to sedate patients. A direct link to Dr. Harrington has not been proven, but right at 75 former patients of Dr. Harrington's have now tested positive either for hepatitis or HIV.
I don't know of anybody that's happy with what happened with Dr. Harrington.
State Senator Brian Crane from Tulsa is pushing for change. He says lawmakers and the state dentistry board are working to make regular inspections of dentist offices mandatory.
Right now, we license the doctor, but we do not license the facility. And so what the dentistry board is talking about is that we will establish a licensing requirement for the dental facility.
Another issue is making those records more accessible to the public. Henry Hartzell with the State Health Department says they're working towards a goal of more transparency by putting more records available online.
We're part of a pilot program to modernize and make state government more efficient. We're one of 4 agencies that was selected initially to develop and implement an online license application system.
Lawmakers say they hope to get something on the books this legislative session, but definitely by next year. And once dentist inspections are in place, lawmakers will look at doing the same for doctors' offices.
If there is any silver lining in this cloud, I think it's going to be the recognition that we need to do a better job of monitoring and inspecting what's going on in these dentist offices statewide.
Okay, that looks good.
Health inspectors like Larry Little say more accountability and oversight can make a big difference with public health.
Honestly, yeah, I think so. I think so. Just because there is that certain portion of the population just in any given industry that's going to be there to cut corners or not try to do the right thing.
Now, obviously, a number of new health inspectors would have to be hired, and lawmakers are looking at increasing the licensing fee for dentists to cover those costs.
But they have to act fast to get it done this year.
They sure do. By law, the legislature has to adjourn by the last day of May.
All right, thanks, Russ.